Hi, I'm Meg Laporte with Provider Magazine, and we're here today with Gary Kelso, who's president and chair of Mission Health Services in Salt Lake City, Utah. Gary is going to tell us a little bit more about the Eden Alternative. And I'd like to ask you, what has it meant to you personally to go through this process of adopting Eden Alternative?
You know, several years ago, I worked in long-term care my entire life, virtually. I've been 45 years into this business, and it became very obvious that we needed to transform who we were as a profession. And the Eden alternative was presented to me a few years ago. I didn't quite understand it, but we decided to begin this journey. And what we quickly found out that this journey is an opportunity to transform your organization, your employees, the image of our whole profession around the process of becoming what we call world makers for our residents, which we also call elders.
Mm-hmm.
Elder is a term of respect. Um, and so through this journey, we've been able to transform our organization to be more resident directed and resident focused. We ask our employees to become world makers for the elder. If you think about it, what is a world maker? A world maker is somebody who takes an elder who comes to our community, who has lost the ability to drive, to interact maybe with people in the community, and we have become the world for them. So we bring the world to them and give them opportunities to grow.
That's great. So what has this journey meant for your staff?
You know, it's an amazing journey because so often people come to work in long-term care because they truly believe that they have a calling to care for the elderly. But also, it's a very difficult job. It's probably one of the most difficult things I think I've done in my career. And so, what the Eden Alternative does, the Eden Alternative brings an opportunity for people to become partners, and we call them care partners. We don't call them, staff. We don't call them, whatever. We call them care partners because they partner in the care being provided to the elders in our communities. And being a partner means they get to be a part of the decision tree. They work with that elder who makes choices. They choose whether they want to wake up, they choose when they want to eat, they choose what type of care they're going to be given. And by including and giving that elder the choice in all of these things in their life, we partner with them.
Mm-hmm.
So our staff really has grown. They've grown. They've become more vested and more engaged in the quality of life for the elders every day.
Wonderful.